We all have health needs, whether it's long-term treatment for cancer or medication for high blood pressure or a cast for a broken bone. It's the cost of being human. But when it comes to those who are here illegally, such as undocumented immigrants, who pays for their health care? Just 1 year into Colorado's inaugural health care insurance program for undocumented immigrants, we continue our deep dive into immigration in Colorado, the health of the matter. To understand this complex issue of health care for undocumented immigrants, we're taking you back to school. And to do that, we have to start with the very basics and build from there. Don't worry, we won't be trying to explain the laws of physics, but healthcare insurance, which, quite frankly, might just be as complicated. At any rate, we will start here. Anyone who comes through the doors of an emergency room must be treated. The federal law requires medical staff to treat and stabilize anyone, regardless of their health insurance or ability to pay.
Okay, let's get you fixed up.
When it comes to undocumented immigrants, they can only access federal benefits that apply in those dire, life-threatening emergency circumstances or childbirth. While those non-citizens are eligible to purchase private health coverage or even insurance through their employers,
here, sign this form.
Even the Affordable Care Act or Obamacare prevents undocumented immigrants from buying marketplace health insurance that would allow them to tap into the full range of coverage beyond emergency care.
The law heretofore undocumented immigrants aren't eligible to buy marketplace health coverage or for premium tax credits and other savings on marketplace plans.
But a state-run healthcare insurance geared specifically for undocumented immigrants called Omni Salud is raising eyebrows. Under one tier of Omni Salud, if an undocumented person makes $20,000 a year, they qualify for the Silver Enhanced Plan. They pay no premiums, and medical needs are completely covered, like $0 doctor visits.
And what seems to be the issue today?
Maternal care visits and diabetic supplies. If they're making more than $20,000, they can purchase a different plan and qualify for deeply discounted premiums. But it's that healthcare marketplace plan that a trio of Republican congresspeople say violates federal law. Colorado Representatives Doug Lamborn, Ken Buck, and Lauren Boebert authored this scathing letter in 2022 to the Department of Health and Human Services, Treasury Department, and Center for Medicare and Medicaid, asking that it be denied. The letter states it encourages illegal immigration, incentivizing millions to violate the law and pour across our borders. It is a policy that forces tens of millions of federal taxpayers to subsidize lawbreakers against their will. Monica Caballaros with Connect for Health Colorado, that oversees Omni Salud, explains their position.
It's really good for the whole healthcare ecosystem and keeping costs down for everyone by getting more people insured and making sure they're not in a position where they're using the emergency room as a place to get routine care.
And now for some more math. In the inaugural year of Omni Salud, $73 million have been paid to insurance carriers for medical needs. But just where does that money come from? And are citizens underwriting medical expenses? In short, yes, indirectly. It stretches back to Colorado Senate Bill 2215, establishing the Health Insurance Affordability Enterprise. It pulls money from insurance carriers, hospital special fees, pass-through federal funds from the U.S. Treasury, and the state's general fund, all of which get money from everyone living in America. Now, Representatives Buck, Boebert, and Lamborn all declined further comment on this story. However, a spokesperson for Congressman Buck tells me they plan to reintroduce a bill that would prohibit federal tax dollars being used for undocumented immigrants sometime this summer. It should also be noted a recent article from the Journal of the American Medical Association states that immigrants generally use fewer health care services than similar U.S.-born citizens and therefore have lower medical expenses. And as with any type of insurance, we all contribute and shoulder the burden of any claims that are made from citizens and non-citizens alike, wealthy and impoverished.